So hi, my name is Joel Chavez, and today I'm going to be going over oropharyngeal airways. So the first thing you want to do is verify the physician's orders. So why was an OPA ordered for this patient? And the only real indication for a OPA would be if the patient cannot protect their own airway. And the only real contraindication for an OPA would be if the patient has an intact gag reflex, then you would want to choose something else. So next you're going to want to look at the patient's chart. Why was an OPA, again, why was it ordered? Did they overdose on drugs? Are they an aspiration risk? Anything that will let you know what you're going to get, what you should expect when you go into the patient's room. Next, you're going to want to gather your equipment. So here I have a variety of sizes of OPAs because you're going to want to measure before you insert an OPA. And to measure an OPA, you're going to want to measure from the corner of the mouth to the bottom of the earlobe. And you can see this one's a little bit too big, just as this one would be a bit too small. So you're going to want to find the correct size of OPA. So it will be a good idea to bring a couple with you, different sizes, just so you can get the correct one. So from the corner of the mouth, tip of the earlobe. So this is the size we will be using. So next you're going to wash your hands. You're going to go inside the patient's room, introduce yourself. If the patient should be unconscious, so you can check their medical wristband to verify who they are. If the patient's family is in there, you can explain what you're going to do. So you can explain, I'm here to help establish an airway, so I'm going to be inserting this into the patient's mouth. There shouldn't really be any complications. It should be real simple. So once you verify that and get their consent, you're ready to begin. So you're going to want to grab your gloves. And if you need to measure the OPA a couple times, that's fine. Just make sure it's the correct size. And to insert it, you're going to want to insert this curved part on the top of the patient's mouth. So, like so. You're going to want to go in about halfway or until you feel resistance. Then you're going to want to turn it 180 degrees and then just push it all the way down. And it should rest on the patient's lips, like so. If it sticks out too much, then you probably have the incorrect size, and you're going to want to evaluate another size and go ahead and insert another one. So that's how you insert an OPA. And to remove it, you're just going to want to go with the natural curve of the OPA. So you would just grab it here. You can grab it with 2 fingers and just pull it straight out. So once you put in a patient's OPA, just going to want to remember the size, the time that you placed it, so you can go ahead and chart that. And then that's how you establish an OPA.